Hi guys, it's Mary from Paraclete Physical Therapy at Rappahannock Foot and Ankle Specialists. Today we are going to talk about plantar fasciitis. Plantar fasciitis is an inflammation of the plantar fascia, which is a thick fibrous band that runs along the bottom of the foot. Let's take a look. The plantar fascia originates right here on the heel. It runs up the bottom of the foot and attaches to the ball of the foot and extends into the toes. The plantar fascia supports the arch of the foot. It can become overstretched and develop micro tears. It's these tiny micro tears that actually cause the pain and inflammation that you feel in your feet. And here are some simple suggestions for treatment. First of all, start by wearing a good supportive shoe or inserts, which helps support the arch and distribute the pressure more evenly amongst your foot. Secondly, you can use a cold pack. Apply the cold pack to the affected area, but first, make sure you have some sort of a layer between the cold pack and the actual foot. 10 to 15 minutes, 2 to 3 times a day would be great. Also, wearing of a night splint actually helps. The night splint keeps your foot in more of a neutral alignment. There are so many different types of night splints out on the market. This is just the one that we have here in the office. But basically, you put your foot in, you wear it throughout the night. It keeps this more in a neutral position, so it avoids the tendency to have your foot in this pointed down position. When you have your foot in this pointed down position all night, everything on the bottom of your leg gets tight. So, some simple stretches that you can do if you don't have the night splint before you get out of bed to actually stretch the plantar fascia in the back of your leg and your calf muscles is just to bring the foot up, hold for a few seconds, and then just relax it down. Give me about 5 or 6 reps of these. And that helps stretch the bottom of the leg. Next, you can bring the foot in and then bring the foot out. This loosens up the ankle joint. Five or 6 reps. Then you're going to take the in and out and make big circles. 5 circles to the right, 5 circles to the left. And now, let's get up and do some exercises in a different position. All right, now that you're up, there is a stretch that you can do also before you put your feet on the floor, which will increase the flexibility on the back of your leg and through the plantar fascia. All you need is some sort of a belt. Strap, a ratchet strap, a dog leash, even the belt to your robe. What you're gonna do, it goes on the balls of your feet. You're gonna grab the edges. Make sure your foot is in a neutral position. Gently pull back as you sit nice and tall. And you're gonna hold that for about 30 seconds. Give me 3 repetitions. And then you can get up and start your day. All right, the next exercise is doing a self-massage with the use of a golf ball. So the first thing you're gonna do is find the area that is kind of sore on your foot. Then you're gonna place that golf ball on that sore area. So the ball will be on the floor, you're going to take your foot and apply gentle pressure. As you apply the gentle pressure, you're going to actually roll your foot back and forth over the area, hitting any area that is sore. Go ahead and do this for about a minute, 2 to 3 times a day, and it actually should make the plantar fascia feel a little bit looser and better. And for our next exercise, we brought in Dr. Donato to explain doming.
So a couple of key points that I'm looking at with doming is one, is something called subtalar joint neutral, okay? Big term, but basically it's more of the natural place your foot should be in. So I squeeze here, a little pinch, okay? And then as I roll her out, there's a dell here and a dell here even on both sides. That's her natural arch position. So when she goes back down and then we have her dome, which is, scrunch her toes and bring up, she's going to that position ideally. And she's gonna hold that 3 or 4 seconds at a time, and that's a good firing of those muscles here, okay? The important thing here is when you watch her toes, that they're not curling under like this, because then you're working the leg muscles. You want to make sure that she's grabbing and feeling, you can see the toenail polish on the top. And that's really helping us because that tells us that that's where her toes should naturally be. That we know we're just using intrinsic foot muscles, the ones down here. If the other thing with her, because she hasn't done this a lot, you can see her big toe comes right off the ground a little more than it should. Over time, that will start to grab the ground better too, if you do this enough, okay? Just a note, the best way to do this is to actually 2 feet at the same time. So you get in your basic standing position, then go ahead and do them both. And you hold them, again, 3 to 5 seconds, got a good muscle fire, and release. Perfect.
Wow, that was some great instruction from Dr. Donato. Now you have the information and tools that you need to self-manage your symptoms. However, if your symptoms continue or linger, please don't hesitate to call Rappahannock Foot and Ankle Specialist. I'm Mary. Have a great day.